Shodair Children's Hospital provides mental health services to children from every corner of Montana. This tour provides an inside look of what patients can expect to find if an inpatient stay is needed. Shodair's state-of-the-art 82-bed facility was built with 5 words in mind: open, safe, intentional, hopeful, and flexible. The new hospital opened in 2023 and was designed through countless hours of patient, family, staff, and community feedback, working to improve patient safety and comfort. One highlight is that all patients have private bedrooms and restrooms, creating a therapeutic and healing space, taking in consideration individual needs. Shodair provides inpatient, acute, and residential psychiatric care for children ages 3 to 18 years of age who are experiencing behavioral challenges. It's the only facility in the state with acute and residential inpatient programs under one roof, and the only facility offering acute care for children under the age of 12. The average stay in an acute unit is around 10 days, and the average expected stay on the residential unit is about 60 days. Primary diagnosis of patients at Shodair are major depression, suicidal ideations, bipolar disorder, schizophrenia, oppositional defiant disorder, and more. When arriving to the hospital, patients are greeted by a registered nurse and a patient care coordinator. Once vitals are taken and all the paperwork completed, the patient is introduced to the acute or residential multidisciplinary treatment team responsible for the child's ongoing care. During treatment, patients participate in individual, family, and group therapy. Clinicians say that having family involvement in therapy and treatment planning only improves the positive outcome for children. Patients and families will work together with medical staff, including providers and pharmacists, mental health therapists, nurses and mental health technicians, patient care coordinators, nutritionists, educators, an allied therapy team, and many others to plan and guide treatment. Each child's treatment plan is developed and tailored individually to meet the specific needs of the child and family. Patients can play games in the outdoor courtyards or our full-court gymnasium. They also interact with facility dogs, Banksy and Baymax. In the summer months, patients spend time in the learning garden and Challenge by Choice ropes course. Recreation activities are strongly encouraged and include art and music, giving patients the opportunity to heal and express themselves creatively during care. Patients spend time in the life skills classroom, where they gain skills for everyday life such as meal planning, and are afforded the opportunity to cook and bake by following recipes and budgeting. Shodair has a reflection area that patients and families are welcome to utilize for their spiritual needs, regardless of denomination or practices. There is also a smudging room for our Native American patients. The Hope Space is like the family room of the hospital, and by far the patient's favorite space. It's where movie nights are held, where patients engage in craft projects, play games, or have a friendly Just Dance competition. It's also the room where prom is held, where graduation is held, family meals, and other special events. Shodair has an accredited school within the hospital with teachers who hold special education endorsements. Our residential patients are enrolled in our school, and acute patients attend school throughout the week to maintain school readiness skills. Our educators coordinate with the patient's homeschool to determine appropriate lessons planning. Maintaining academics is a priority in the care plan of every patient. Through Shodair's services, patients learn to identify their emotions, their triggers, and how to engage coping skills for the challenges life brings. Learning to manage emotions and regulate behaviors is a key component of what is learned during an inpatient stay at Shodair. Our treatment team takes a holistic, trauma-responsive approach to care through the sanctuary model. Sanctuary's commitment to trauma-informed care signifies that Shodair is committed to providing a safe, healing environment for patients and a better work environment for staff by mitigating the effects of adversity and stress. Shodair's new hospital is the safe space that Montana kids deserve. It's a space where voices and needs are heard, where growth and change are celebrated, and where healing, help, and hope begin. To schedule a tour of the hospital or to find out more about Shodair, visit shodair.org.